Hello and welcome everyone to today's Take Control, Maximize the Schedule, and Optimize Productivity webinar. My name is Jacob Workover here on the webinar team at Rectangle Health, and want to thank everyone for taking time out of their days to join us here. So we've got a really great presentation in store for you, and I'm excited to have everyone here. So before we jump into it, just a quick background on who we are at Rectangle Health. We offer HIPAA, OSHA, and PCI compliance, patient engagement, and the best payments solutions in the business to over 35,000 different medical and dental practices all across the United States and all 50 states. And we are happy to service our clients in every way that we can. So a few quick housekeeping notes here before we jump into things. We are a PACE accredited AGD provider of CE. So you will be receiving one CE credit for this course. It's under AGD subject code 550, which is practice management. So you will be receiving your CE credits within 2 weeks from today's presentation. So be on the lookout for those CE credits in your email inbox. If you don't receive them after 2 weeks, shoot us an email and we'll be sure to take care of you. In order to get that CE, we need you to be on for the duration of the presentation. And then we're also going to have 3 polling questions throughout just to make sure you're paying attention and attentive. So make sure to enter those so you can get your CE credits. If you are joining us today from a mobile device and you can get to a desktop, we do recommend that for a better viewing experience, and it'll be easier to answer the polling questions. And then when the presentation concludes, you're going to be prompted to answer a brief survey, and we do ask that you complete that. It's about 5 or 6 questions, just so we know how we did and we can continue to offer the best webinar programming for you and your staff. So if you have any issues at all throughout the presentation or any questions, feel free to put those in the question bar, or you can email us at webinar@rectanglehealth.com and we'll be sure to get back to you. And then we'll be sending more info on this in the follow-up email, but we do have a webinar next Tuesday. It's a HIPAA workforce training. So I'm going to put the link to that in the chat in case you guys would like to join us for another presentation. And we will be including that in the follow-up email as well, along with the recording and slides and other assets from the presentation. So that is my introduction here. And with that, I am very excited to send it into today's speaker, Laura Nelson. Laura is an award-winning international speaker and the founder of Front Office Rocks, which is a virtual training platform for dental teams that teaches office systems and methods to help practices achieve exceptional customer service. Laura received the Public Speaking Award from the Speaking Consulting Network and Dentistry's Got Talent. She also has been recognized as one of Dental Product Report's top 25 women in dentistry, and we are very excited to have her here today. So Laura, with that, I'm going to send it into you.
Well, hi, everybody. Thank you so much for joining us. And Jacob and I are both excited that you're here because I am presenting from an iPad for the first time ever. And I'm in the Orlando airport. So there's a lot of technical issues that we went through to make sure that this happened. So we're so excited that you can see both of our faces. I am Laura Nelson. I am the founder of Front Office Rocks, like you said. And my goal, my thought, my hope with all of this is for us to talk about a subject, schedule, and being productive. That is something that many people aren't fully trained in. So I want to kind of go back to the basics in this little bit of time we have together. And then many people know, but have sort of forgotten about. So that's what we're going to talk about today. And I'm going to jump right in just because I know it's probably your lunch break or you're taking an hour out like I am at the airport. I'm about to fly back to California. So I'm going to present from my screen. So you're not going to be able to see me anymore, but I'll have the PowerPoint up and Jacob's going to be here with us. So if we have any questions along the way, he'll be watching the chat. And I think we're good to go. So Jacob, if there's any issues, just pop in. If not, I'm going to keep going.
Looks great.
Okay, good. So again, thank you. Today, what we're going to talk about is maximizing the schedule. And there's 2 parts of maximizing your schedule that I want to refer to. I'm going to kind of touch on in this webinar. One is your office schedule, your doctor schedule, your production, your patient schedule. And then the other is just a little bit about your own schedule. One thing we can all agree on is there's just not enough time in the day. So balancing having a productive schedule, but not having it run you, as well as being in control of your own day-to-day activities, I think is super important. So first and foremost, I want to thank everyone for being here. I don't know about you guys, but I'm a sticky note queen. If there's any sticky note queens, write in the chat, sticky. I literally, when I got into dental, I should have taken stock in sticky note because everybody comes in and I've got a sticky note. What, can I talk to you? Grab a sticky note. Answer the phone, grab a sticky note. And because of that, there's a million sticky notes on me, and I appreciate you and around me taking time, because if your desk looks like this, to take an hour away to do CE is a huge kudos to you. So thank you for joining us. We're glad that you're here. Jacob already kind of went over who I am. I got into dental 20 plus years ago. I knew nothing about dental. I had to learn it on the fly. Like some of you might be brand new doing the same thing on this webinar with us. But realized over time that what I thought was missing in the dental office or in the dental industry was training of the teams. We didn't have webinars like this when I started. It was before the internet. So training teams and getting the basic training will help you to go back and do well in your job. And so that's really what I started 15 years ago with Front Office Rocks. And since then have gotten the opportunity to fly all around the country. That's why I'm in Orlando right now, to speak to teams live. And hopefully I'll get to meet all of you guys live one day. So before we talk about the schedule, one thing I want to set the stage of, there's a couple of things. One is, we have to remember that our patients don't know if we're good dentists or not. Our patients don't know the amount of CE that you've done, your doctor's done, the amount of schooling that your doctor's gone through, the extra CE that we do. Our patients don't know if we're a good dentist or not. If I walked into the airport and asked a patient about their dentistry, they're not going to say, like, look at this margin, look at the shade match. Like, they don't know anything about dentistry. They know how they feel when they're in the office. And I believe that you can offer 3 different types of feelings in the office or customer service. It's either awful, average, or amazing. If you're here listening to this webinar, spending time on your lunch break or during the day to watch this webinar, you're probably not awful. Your practice is probably at least average. But in order for us to really help our patients, get the dentistry done that they need, help them having a great experience, we've got to be amazing. People are spending more today than they've ever done. And so we really have to make sure that everything we do is amazing. And the reason I bring that up is because as we're looking at our schedules, we have to look at where do we spend time throughout the day, because we could focus our time on production, filling more in the schedule, fitting more in, doing dentistry faster, seeing more patients, and that's great, but that's not going to help our practice grow, and that's not going to give our patients amazing experience. So when we balance our productive schedule and our daily schedule, we also have to take into account we need to give our patients amazing experience, because that's how they judge us. So I'm going to break this down this is real basic. I go way more in depth in Front Office Rocks about this, but really there's only 1, 2, 3, 4, 5, 6, 7 parts that we need to focus on. And when you are building your schedule and improving your schedule and working on this in the practice, I want you to remember these 7 parts, because this is really the foundation of running a successful business. First, we got to market our business. We've got to make sure that we're out there so patients can find us when they need us. Then we have to give our patients an amazing experience. People are only going to talk about your practice and tell others if it's amazing or awful, and you don't want to be awful. But if you're average, we have to think about what we do for a living. We're healthcare providers. We put drills and needles in their mouths. They don't love what we do. So we can't do anything about the dentistry, but we can do something about the experience. So we've got to give our patients an amazing experience. We have to sell them on the dentistry and produce quality dentistry. So selling is case acceptance, case presenting, case presentations, and then producing is giving them quality dentistry, doing quality dentistry. And then we want them to go out and tell their family and friends about us. So that's the basically any business. This is, any general business. So patient experience, running a productive schedule, making sure the patient has amazing experience is the result of them going out and telling their family and friends, which grows our business. And in dental, we also have hygiene and reactivation. And so we, in our small business, know who our patients are. If we do a good job, they should be coming back every 3, 4, or 6 months, hygiene. And if they fall off the bandwagon, we know who they are, we can reactivate them. So when you really look at this small business cycle, if everyone on your team understands that everything we do fits into one of these categories, and we need to run our schedule throughout the day, making sure that we're not only respecting these things that are important, but also balancing the amount of time we spend in these, Because if we spend all our time in production, we don't have enough time to do reactivation, or we don't have enough time to make sure our patients get good customer service. So I start our presentation today with that in mind, because when we get into the schedule, we need to, it's not just about production. It's not just about shoving more in. It's about balancing everything to make our practice successful. We also need to look at the fact that there's a lot of dental offices that are out there that are busy. Busy, busy, busy. Everyone's busy. Hygienists are busy. Assistants are busy. Front office is busy. Everyone's busy. But are we effective, right? When our team members do our tasks or do the tasks, but they don't understand the intention behind them, then we're not working towards the same goal, right? We're just doing work. I know when I used to travel and call back in the office and say, what's going on with the team? What's the front office team doing? Well, they're busy. Okay, what are they busy doing? They're busy. I don't know. They're busy. Everyone's just busy. So we could run around and be busy, or we could be effective. And in order to be effective, our team needs to understand, well, why do I do this thing? Why do I do what I do? And I will tell you, I believe that everything we do in the front office, our intention, the reason we do it is hashtag butts in the chair, right? Confirmation calls, verifying insurance, reactivation calls, hygiene calls, all of that. Our job in the front office team is butts in the chair, because if our patients' butts aren't in the chair, our clinical team can't do what they need to do to help our patients keep their teeth for life. And ultimately, that's what we do, right? Our job is to help our patients keep their teeth for life, live a better life, live a longer life. We are their healthcare providers. So everything we do should have that intention behind it, because we're going to be more effective and help our practice run better and grow when we know why we're doing the tasks that we're doing. However, time is the rarest commodity any of us have in the dental office. We all walk in the morning and we're like, this long list of things I'm going to get done. And then by 3 o'clock, you're like, I haven't eaten or gone to the bathroom, right? So we need to run a schedule that we're in control of, that doesn't run us, and be proactive with our time and time management so that we can get things done, right? So that we're not running around like chickens with our heads cut off. So time management is it's a big thing, right? It's the schedule, because the schedule runs us. It's time management of your team members. There's a pile of instruments to be sterilized, and everyone's standing around the break room talking about the latest gossip. Like, there's a whole bunch when it comes to time management. And so that's really what we're going to talk about today in our 45 minutes, 50 minutes together, of like, well, how do I balance that? How do I make it work so it works for me and for the practice? Now, if you're on this, if you're an office manager, scheduler, front office person, you are probably a lot like me, where we have to be super good at multitasking, right? You're probably like, I am the best multitasker there is on this team. I can do 16 things at once, which I agree. I'm very good at multitasking, and I used to be super proud of. But what I've learned is multitasking is a skill, but it's not necessarily the best skill all the time. When we talk about multitasking, we could do 5 things at once, but are you giving anything your full attention? Are you really giving anything a priority? And I learned about this when I was researching this in the past, of priority. What is a priority? Well, priority should be just one thing. What is your priority? And we only pluralized the word priority into priorities in the 1900s. So that is part of the problem we have when it comes to time management in the dental office, is everything's a priority. The patients in front of us is a priority, insurance is a priority, sterilization is a priority, reactivation is a priority, do they have fluoride coverage is a priority, everything's a priority. Well, when everything's a priority, it's hard to balance what do I do first in what order. So I would, as we go through this, challenge you to start looking at where you're spending your time, both in the practice schedule and your own schedule, and what truly is a priority. Because if everything's a priority, nothing's a priority. So both in your own daily schedule, like if you are sitting there in the office and you're like, man, I walk in at 8 in the morning, and by 3 o'clock, I've barely eaten. I'm interrupted all day long. I get nothing done. I feel like I'm always putting fires out, both in your own personal schedule and in the office schedule. The number one thing you can do when you're starting to look at how to manage your schedule is bring some awareness to it. Let's figure out, where are you spending your time? Personally, if your day feels like it just gets away from you, start to recognize and write down, do a week or two, what do you do every day? What do you do every 15-minute increment? Where are you spending your time? In the schedule with the office, where are you guys falling behind? Where are you not finding time for patients to get in? Like, let's actually look at what we have going on, because you can't change what you're not aware of. So the first thing is to figure out, where does your time go? Then the second thing is to prioritize things, right? Not everything is the same sense of urgency. Not every appointment is as important as other appointments. A crown is more important than a sealant, right? Not only for the practice, because it is a larger appointment, a higher production appointment when you have a crown. A sealant is a lower production appointment and lower money, but also for the patient. A person who needs a crown probably is closer to needing a root canal or losing that tooth versus somebody who needs a sealant, right? So there's a priority of appointments also in your schedule. What's more important? Um, you know, reactivation phone calls or going through the junk mail. Reactivation phone calls are more important than going through the junk mail. So everything should be able to be prioritized to what is more important than something else, because not everything has the same sense of urgency, right? But what we tend to do is we tend to handle whatever's in front of us. We tend to handle like everything. Well, when you do that, everything's important. Everything's a fire. And now your practice is out of control. Your day is out of control because we're not giving anything more importance than anything else, right? And we tend to gravitate towards the things that we like and we're good at, even though some of the other things may be more important. So when we look at where we're spending our time and then what is important and not, they all fit into these categories. Is it high importance or low importance? Is it high urgency or low urgency? And when you're looking at trying to get better time management in your practice, the first thing you want to look at is, where are the majority of the things happening? Because in most dental offices, what I find is it's critical activities. Like, everybody runs around, everything's important all the time. We're all doing stuff, and it's all, can I interrupt you? Can we do this? Everybody's trying to do everything. And when you do that, it's chaos. What we need to do is, when you look at things that happen, like team meetings, morning huddles, primary appointments, um, uh, handling a patient that's running late, whatever, is it high importance, low urgency? Is it high urgency, low importance? Because when we aren't putting it into blocks, it's just all chaos. Okay. So I recommend, when you do your time study, when you look at your schedule, truly looking at the things that you're spending time doing and saying, first of all, is it important? Is it the same urgency as other things? Do I need to be the one doing these? Could somebody else do this? Is there a better way to do it? Could I outsource it? Could I use technology to do it? To find the time that we don't have, right? So I want to ask you guys, what is the goal of everything we do at the front office? This is a polling question just to make sure you're tracking with me. I can't see your faces. It's very hard to do webinars without faces. So Jacob, I'm going to have them do the poll. What is the goal of everything we do at the front desk? Is it, get it done and get out on time, learn how to do clinical assisting, butts in the chair, or know every insurance plan?
All right. I'm going to give everyone about 10 seconds to get in their answers here. All right, Laura, looks like they're paying attention. We had 2% say get done and be out on time, 3% say learn how to do clinical assisting, 3% say know every insurance plan, and then 94% said butts and chair.
Awesome. I love it. Well, all those other answers are somewhat correct. That's awesome. But butts in chair from this presentation. And literally, if you guys quote me on anything and go on the internet and say, hey, I just listened to Laura, she taught me about butts in chair, I'd love that. So thank you so much for that. Ultimately, it's butts in chair. So when we're looking at our days of the things that you're doing, the next thing is to say, okay, well, where can I train and delegate? And this is both good for your own schedule, but also for your assistants, for your doctors, for your hygienists. Like, we tend to be perfectionists in everything that we do, and nobody can do it better than you. But the problem is, if nobody could do it better than you, guess what? You're going to always do it. So we want to make sure that we train and delegate each other in turning over the room, getting more clinical experience, getting more experience in the front if you're clinical, so that we can jump in and help each other out, so that we can, when times are a little bit crazier in one part of the practice or another, somebody can jump in and help. So as you do your time study and you start to look at where are we falling behind in the practice schedule, where am I falling behind and not getting to certain tasks, the next thing to look at then is, okay, well, where can we be more efficient? And it might be your doctors aren't using the assistants fully where they should be, and we can have, cross train a little or train a little bit more there. Or when the assistants have downtime, they can come up and help with insurance, or a front office team member can go back and help turn over rooms. But we really want to start working better as a team, because if you're doing everything all the time, everyone's going to let you, right? They're just going to let you. So I love this quote because Front Office Rocks is based on training, right? And many times I'll talk to doctors or office managers that say, well, what if I invest in training somebody and they leave? Like, what a waste of investment. And I disagree. The only thing worse than training an employee and having them leave is not training them and having them stay. So literally, I would rather train an employee and have them be productive and better productive for me in the short period of time they're with me than have somebody stick around for a really long time and not do it right, or not do well, or not be able to jump in and help. So training is something that I think in the dental offices we are not great at it. We tend to just have somebody sit next to you and watch me do what I do. That's not training. Really investing in your team and helping them know how to do things and why it's important is going to help the practice run smoother, but also free up time in other, those that are overwhelmed, don't have time, free up time so that we can be more productive. So that's one of the foundations of why I started Front Office Rocks, is that, again, there's a lot of things we do in the office that we just don't train our team members to do, and then we expect them to be good at it. How to handle, recall patients, how to handle disgruntled patients, how to talk to a patient about a $10,000 treatment plan, how to handle a patient canceling last minute. Like, we need to make sure that we invest in our team, and each person from their perspective, letting them watch videos or read an article or watch other people do things so that they can learn, because we just expect people to know it, and of course, a lot of people don't know how you want it done in your office. Then we have to look at distractions and interruptions. What you allow, you will always get. So if the picture of the sticky notes in the beginning and the lady with the sticky notes all over her, if you are the person who somebody walks in and says, do you have a minute? You're like, yep, but you really don't. If you allow people to continue to, do you have a second? Yep. Can I interrupt you? Yep. Can I ask you a question? Yep. It's going to continue to happen. So the next part then is to recognize, where do you need to block your day? And you're going to hear it both in your own personal day of schedule and the office schedule. Where do you block things in your day so that the priority things get done? And it's important to block time in your schedule, because if you don't teach or show the rest of the team, like, this is important to me, this is my time to get things done, it's not going to happen. And you've heard about it in your personal life. It's the same of like working out. If you don't set time in your schedule, many times there's just not enough time. So prioritizing it and putting a block in your schedule, in your day, however you need to do it, so that people don't distract you and interrupt you, allows you to be more productive in that important things that you need to do. And then pick the best time of the day to do this, because procrastination is killer. I'm super guilty of it when you think about working out. I have to work out in the mornings, because if I don't work out in the mornings, it just doesn't happen. So I have to block it in my day, and I have to have my day start a little later so that I have time to work out. Make sure that you are picking the best time to get things done. For example, I don't know that I would do reactivation calls on a Monday morning, first thing in a dental office. It's the craziest day and time of the week. I would probably think you want to pick the best time of day for reactivation calls, or like a Wednesday or a Thursday, right? So, really making sure that you're scheduling with the highest chance of success to allow it to happen. Okay. And then look for new solutions, because there's a lot of technology out there that will help us save time and money. I just happened to discover this great company called Uptime Health, and their focus is on managing the equipment in the practice, right? Because when the equipment goes down, we don't have uptime, we have downtime. So finding software like, companies like Rectangle, Front Office Rocks, Uptime Health, appointment reminder softwares, all of these ones that can help you manage the day so that you can be as efficient as possible, and maintain the equipment, maintain your training with your team, making sure that everybody is where they are supposed to be doing what they're supposed to be doing, adds more time to your day, right? So make sure you're looking outside of the way you're doing it now to other options and opportunities out there, which leads to encouraging solutions, right? Encourage solutions, finding ways from, this is why you're here with me today. You're looking for new opportunities, and thank you, Rectangle Health, for bringing all of these great webinars to you guys, because that's the idea, is we're looking for solutions that we may not be aware of. The other thing is to train your team to bring solutions to you, to talk in the way of, we have an issue. I don't like the word problem, but we have an issue, and here are a few solutions to what I think we could do to fix that issue. What that does is it allows your team to think independently, and it teaches them to be problem solvers. And instead of always dumping stuff on your desk, they now come with, here's an issue and here's three solutions, and you can pick A, B, or C, or you can explain to them why those solutions won't work and what you suggest. So we want to build a team that's forward thinking and self-reliant, not one that always brings everything to one person and gets dumped on your desk. Because again, if you're always the one that's getting dumped on, you're going to always be the one that has to handle it. All right. So how important is training your team on a regular basis? So the idea of what I've talked about here, this is a polling question for you guys. Do you think it is important, very important, to train your team and cross-train your team, or not at all? I would hope we get 100% out of this one, Jacob. If we don't, I'm a little worried about what I've done so far. So can you guys give your answer there?
Laura, we're close, but
Are you kidding?
98% is very important. The 2% of you, I don't know what to say.
Yeah, you know what? Okay, the 2% of you either weren't listening, or you are a control freak, and that's a good name I'm giving you. But it's hard to give up control, and it is when you think about cross training and delegating, and immediately you think nobody does it as good as I do, and I agree with you. Nobody probably does that task as good as you, but do you want to be doing it everything all the time, or do you want somebody to do it 90% as good as you could, so that you could do something else? So I would say, if you really truly don't think training's important or delegation's important, maybe go back and do some inner self work. Okay, so that's about halfway through. Now we're going to jump into the actual practice schedule. And I love to train on acronyms. And the reason I started this actually on your own schedule is to show you that a lot of the tasks that we do, the things we have to get done, the priorities that we need to do, they don't happen because many times our schedule runs control of us, right? And so I wanted to show, like, there are some things that you can do personally for your own schedule, but now we've got to make sure that we're building a schedule that is productive. We hit goals, but also allows us to be able to block out time in our day, delegate, train, all the things we've talked about. So now we're going to jump in the practice schedule, because it is the foundation of our practice. And I like to work with acronyms. It helps me remember what I'm teaching on. So this part, which is the schedule, the dental schedule, the schedule impacts everyone. So our acronym is IMPACTS. Okay. So if you're taking notes, write down IMPACTS, and we're going to go through what that is. Okay. Now, I can't teach you how to build a productive schedule for your office because every office is different, right? The amount of providers you have, what your providers like to do in the morning or afternoon, the type of procedures they do, how many chairs you have, like every schedule is different. So we can't just say this is the one right way to run a schedule, but your team and you, and I'm going to talk about this at the end, you need to have a scheduling, you need to have a scheduling policy. The second thing I can tell you is the reason we don't have necessarily a policy day in and day out is because we can only predict one thing, that whatever our schedule looks like in the morning, it's going to change, right? So we've got to be able to be adaptable. However, we also need to be in control of our schedule. So we can only need to be adaptable so much, but at the end of the day, this is your practice schedule, and you need to build a schedule that everybody believes in and understands in your practice, and that your patients know they need to follow, right? Okay, because what happens right now is that we just walk in and we cross our fingers and hope the day is going to go well, right? We walk in and we're like, man, today's schedule sucks. Okay, cool. Good luck. I'll see you at the end of the day, right? And anytime we're just throwing stuff in the schedule and we're not actively in control of it, we're not doing it in a smart way. That's why we run around crazy and we get to the end of the day and we're like, we only produce how much, right? Because we're letting the schedule control us. So here's your impacts. So the first part of this, the reason the schedule is so important is it not only impacts every team member, but it impacts your patients. I started this presentation with your patients don't know if you're a good dentist or not. They only know how they feel when they're in your office. They know the experience in the office. Well, the schedule is that experience, right? How great is it to tell a patient that they need to come in at 1:30 for an appointment and we don't see them until 2 o'clock? How great is the experience when we tell the patient the appointment's going to take 20 minutes and 2 hours later, the doctor still hasn't come in? It's not a great experience. We have to respect our patients' time as much as we want them to respect our time, right? And we have to remember people don't like to go to the dentist anyway. So the better we can run our schedule so they can get in and out, it's predictable, they know what to expect. And of course, stuff comes up, right? But the better we can do to run a schedule that respects our patient's time as much as ours, the better the experience is going to be for the patient. The next thing is for the team. I think the schedule is the most important system in our office because it runs all of us. It impacts everybody's job. It is the foundation on whether we're going to have a good day or a not day. It is the biggest stress that running behind, putting emergencies in, trying to turn over rooms, see the next patient. It's the biggest stress that we have within our team. And it's the biggest difference between whether we get to lunch on time or we get to leave at the end of the day. Like one of our great people already said, I want to get out on time, right? Well, run a schedule that runs on time, you're going to get out on time. And I believe it determines the mood of our doctor, right? You guys all know the difference between your doctor walking into a very well productively scheduled day or a day that looks like Swiss cheese or a day that's like chaos. Our doctor's moods, and it's better to work for a happy doctor, right? Than a stressed doctor. And then last, but most importantly, it is the initial reason for drama in the practice. I believe the schedule is the reason we have drama in the office because she said do this and she said squeeze the emergency and the doctor said do this and the assistants are pointing at the hygienist and the hygienist at the front office, and it's because it's controlling us. So when we get stressed, we point fingers at other people and it causes the drama in the practice. So if you can build a schedule that is effective and runs well, not every day is going to be beautiful, but runs relatively well, your team's going to get along better. Okay. Which leads me to the second one, make it a game. The thing about this schedule is it's always going to change. The thing about the schedule is it's always going to be a area for stress. So we need to make it fun, okay? Because we can have days that are, $5,000 day, and the next day is a $500 day, and then a $15,000 day, and then a $1,000 day. And a great day might look great on paper, but be more stressful for the entire team. And a bad day might be holes in the schedule, but it might be a great day because the doctor's doing a procedure they like. Like, we don't know if we're winning the game or not. And we have high days and low days. In order to play a game, any game you play, there has to be a score. And so the team needs to be on the same page of what the score is. What are we judging? It really needs to be around production and scheduling, production and collections, right? Production and collections. And really, production is the foundation. What we produce, we're going to collect on. I'm not talking about insurance and non-insurance at this point. That's a whole other topic. But what we produce on. Well, if your team is set, for example, to do on average $5,000 a day, and you do a $20,000 day, oh, that's a lot of work, extra work for a team that's set up for $5,000. But if you only do 500 in a day, now we got people standing around staring at each other. So in order to play the game consistently, we need to know what game are we playing and what are the rules. Like, how are we judging how we're doing? And so what I suggest is everyone on your team knows at any given time, if I walk in, how are you guys doing on your goal, collections, productions, new patients, and reactivated patients? Because everybody on the team is playing, you're all on one team. It's not just the doctor and the office manager who should know these numbers. This should be shared amongst the team, because the team should be able to jump in and say, hey, I have some ideas of how we can do this or how we can fix the schedule today. And we want it to be people who are coming with suggestions, not just problems, right? And since COVID, I've added to this. I used to say collections, productions, and new patients. I've added, since we had this, like, everybody shut down for a while, reactivated patients, because I believe we have a backdoor problem. And there's a lot of patients who've slipped out of our back door during this pandemic that we need to get back in. And so I think that everybody on the team should be looking at that, because it's not just about the front door, it's also the back door. Okay. So let's break this down for a minute, just to use an example for this webinar. If we were keeping score, if we wanted to know how we're doing against our goal, right? So we start with a month in mind. So let's say our goal for our team is 60,000 for the month. Doctors should be producing 70-ish thousand, hygienists 25, 30% of the production, or, doctor production versus hygiene production. So if you break it down there, 70% is 42,000, hygiene production is 18,000. We're open 16 days this month, so therefore the doctor should produce around 26.25 and the hygienist 11.25. That just, now it shows me as the scheduler and as a team, okay, well, what do I need to put in the schedule every day for the doctor and hygienist on average? I would rather have it be around that average every day versus 10 times that average one day and 1/10 of the average the next day, because then we have that up and down graph. What I want consistency, so that every day we can walk in and produce about the same amount. So it keeps we know how to produce this, we keep it at the same level, and we know what we're doing on a daily basis. Plus, I know if we're winning at the game or not, right? Because attitude is everything. So I want people to know, like, all right, guys, we're doing it. We've got 26.25 or 4,000 in the schedule or 5,000 in the schedule. The next 3 days, this is awesome. What can we do for Friday, right? Because if not, the schedule stresses you out, right? And so what I want to make it a game, and I want the team to be on the same team, and so that we feel like we're in control of it and we know where we're going. Okay. Now, the next way to do this is to put the primaries in first. Primaries are going to be your large dollar value appointments. So for your practice, you need to figure out what that is. I say in our practice, it was anything $1,000 or more. So any appointments $1,000 or more goes in the schedule first. Secondaries are the second appointments, and then secondaries are anything low dollar value, like a one surface filling. And tertiaries are that no dollar value at all. So maybe a delivery. Okay. We want to put in our schedule first the primaries, because we're going to hit our goal if we have the primaries in first. Because if our primaries are $1,000 or more, our goal for our doctor was 26.25 in our example. It's only going to take me 2 primary appointments to be 75% of the way to the goal, versus tertiaries, it would take me 10 to get to the goal, right? So I want to put our primaries in first. Now, I want to block our primaries. So here's my example, right? Let's say a primary is $1,200 on average. It's going to take 2 primaries versus 8 secondaries and tertiaries. If we fill the day with all tertiaries, we're never going to hit our goal. But I want to block for it because we have the practice management software that has like perfect day scenario. That's great, but you can schedule right over it. You can't see it. If I'm cross training people on my team to be able to make appointments for patients, I want to make it super easy and obvious. Like these are saved for a primary appointment, because if I could schedule over it, I'm just going to schedule over it and not pay attention. So I want to block the schedule to 70-75% of my daily goal every day, and those blocks or events or whatever you use in your software don't get moved until a primary appointment gets put in. So you actually physically put an event or a block in there. And then when a primary appointment is ready to be scheduled in that day, you take the block, you move it forward, and you put the primary block in there. You put the primary appointment in there. Because I want to make sure I'm holding spots for the bigger appointments that are going to hit our goal. But many times also, they're not just a larger dollar amount, they're also larger in size of the amount of time it takes, right? They're a larger appointment. And what happens is if we fill our day up with a bunch of tertiary and secondary appointments, when we go to try to put a primary appointment in, we have 1 or 2 options. One is to sideline it, and then we're running around crazy on that day. Or we take this primary appointment and we put it out 3 weeks from now because there's no spot for a 2 or 3 hour appointment. Well, when we do that, we're missing our daily goals because we're not putting the primaries in right away. And we're not, our patients have 2 or 3 weeks to potentially talk themselves out of getting the dentistry done and canceling. So there's so many benefits to putting the blocks in and then putting these primary appointments in first. Much like we talked about at the beginning, you got to block in your schedule, right? When you want to work out or you want to get things done, you've got to put the blocks in, or life's going to happen and they're just going to get filled up. So you've definitely got to add the blocks, and the block appointments go right into your schedule. Also, anything that's important that you don't have time typically in your schedule to find time to do, you should block. So team meetings should be blocked in the schedule. If you have problems with new patient appointments, put blocks in the schedule for new patient appointments. New patients should be scheduled in the next 2 to 3 days, not 2 to 3 weeks, right? Block for new patient appointments. If you have problems finding spots for perio, or if you do any specialty appointments, procedures, put blocks in there if you're having problems finding time for them, because they're important enough to have them in the schedule. And then everything else is going to fall around the important primary appointments. Okay. Next is continually improve. So many times we build this schedule and then we think, oh, that's 2 weeks from Thursday, it'll be fine. And then it's 2 weeks from Thursday and we're like, oh my gosh, today's schedule is awful, right? We should continually be improving the schedule all the way up until like the time of the schedule. And what I mean by that is, look at today's schedule. Today is the most important day in the schedule. Does today look good? Does everything look like it's going to flow okay? Are there any gaps we need to fill? Are there any emergencies that we need to be able to squeeze in? What does today look like? Once today looks great, awesome. Let's look at tomorrow. Tomorrow looks great, awesome. Let's look at the next day. Great. Let's work on Wednesday, right? This is the most important day. Unless something happens with today's schedule. And if today starts to fall apart, we need to go back and work on today. So we need to be continually improving the schedule and looking at it. Even in the morning huddle, if you're like, wow, today sucks. Well, what can we do to make today better? And maybe it means moving a patient up or down 20 minutes. Maybe it means having somebody from the front jump in the back to help turn over rooms. Like, continually look for ways to make the schedule work better for you and your team. And don't just be satisfied that it's full, right? We should be scheduling to production, which means, what is your daily goal? And we should be finding ways to hit that goal each and every day, which means putting the primaries in first, blocking the schedule, and then making sure we're doing everything to hit that goal every day. Which leads me to training. And again, you knew I was going to talk about training. This is my foundation at Front Office Rocks. But it's amazing to me, and I wish I had you guys in a room and I could say, how many people have never actually been completely trained in productive scheduling? Because what I'm doing right now is like a 15-minute overview, but there's a whole training. I mean, I have a 2-hour or 3-hour training just on productive scheduling that most schedulers have never learned. Most of us were learned how to do it the way Susie taught us the day before, right? The most of your team have never been taught productive scheduling. Now, I'm not expecting everyone on your team to be an amazing scheduler. One person should be in charge of the schedule, but everybody on your team should be trained in aspects of it to understand why the schedule is built the way it is and how they can help hit those goals, right? So when we come in the morning huddle and we're like, we're not at goal today, what are some things that we all can do to help with that goal? Because it's our entire team, not just the scheduler who's responsible for it. Part of it is this: training the team to make sure that we're offering appointments correctly, right? We don't just want to ask our patients, like, when do you want to come in, or do you want to schedule? The worst thing I can hear somebody say to a patient is, do you want to schedule your appointment? Because what is the patient going to say? No. I mean, we put drills and needles in their mouths and they pay us thousands of dollars for something nobody's ever going to see. Nobody wants to do that. So they're going to say no, right? So we don't want to say, do you want to schedule? We want to say, we don't want to say, when do you want to schedule? Because more than likely they want to schedule Friday night at 5 o'clock. And we don't have any appointments Friday night at 5 o'clock, right? So I believe it's important to make sure your team is offering appointments the best way possible for your patients. Now, I'm not a huge fan of scripts. I don't think scripts are the way to do it. I don't think scripts work because we're more focused on the script than we are the patient. But I do believe your team should be trained. My way I say it, and this, you can take any variation of this, is, you know, we can, are there a day of the week or time of day that's better for you? Tell me what works for you and I'll see what we have available. Like asking the patient to narrow down the time frames of the week that look best for them, and then going into the schedule now, and I'm going to look for appropriate blocks or times that procedure fits well into our schedule, and I'm going to offer them 2 times, right? I have Friday at 10 or Thursday at 2, which is better for you. But it's us being in the control of the schedule, not the patient. Because if we ask the patient, when do you want to come in? And they say Friday at 5, and we're like, sorry, we can't schedule you then. Not only is that, it doesn't look like great customer service, but also we're letting them control it versus us controlling it. So training all of your team members to offer appointments is important if all of your team members potentially would be the one to schedule a patient or move a patient. Which leads me lastly then to scheduling policy. Again, I started at this section talking about that I can't tell you how to run your schedule. You need to run your schedule, right? It's your practice. However, your team needs to be on the same page. If your team's not on the same page, that's why your schedule is chaos. And that's why we have drama and we point fingers at each other, because people are just doing what somebody else told them to do or what somebody trained them to do before. And then we have a schedule that just doesn't run well. So my suggestion is be more proactive about your schedule. I suggest you have a team meeting where you sit down and everybody talk about all the scenarios of how your schedule potentially falls apart, how you fall behind, where it gets stressful, how much time do you need for appointments, and then write a policy that you can all agree on. Now, I'm giving you a 90-second overview of how to do this. If you get trained in how to do this, you can, understanding all the things we need to talk about with the team, we can now agree on, this is how we're going to handle late patients. This is how we're going to handle emergencies. This is how we're going to handle when the doctor runs behind. And post it in the office, post it in your break room, post it somewhere, and then everybody now follows it. There's no more blame. There's no more pointing fingers. There's no more drama, because when the patient runs late, we're not running around asking what to do about that. We know exactly what to do, and we just handle it according to the schedule or according to the policy. So that is my recommendation of how you run a productive schedule, because you want to make sure your entire team is on the same page. Okay. So one more polling question here before I end on a final note for you guys. What acronym did I use to teach about dental office schedule? Was it impacts, molars, prophy, or clock? They're all similar in length, but if you're paying attention, what was that? And I want 100% here, Jacob. So please help me see that we've got 100% on this one.
All right, we'll give everyone a few seconds to get their answers in here. All right, Laura, we were close.
Ah,
95 to 1 and 2. So we almost
okay.
did it.
All right, we were pretty close. Well, for those that didn't get impacts, you can go back and come find us at Front Office Rocks, and I'll teach you there. So, okay, so my final thoughts for you guys is the bad news is time flies, but the good news is you're the pilot. The one thing, no matter where you are in your, you could be in New England, San Diego, you could be in, Texas, Florida. It doesn't matter. The one thing we all agree on is there's just not enough time in the day, right? And people often complain about lack of time, but really it's the lack of direction that is the real problem. So literally getting in control of your schedule, both your own schedule and your practice schedule, is going to give you the time that you need to get things done, which includes having a lunch snack and going to the restroom, right? So I hope that this time was worth it for you, that you could take some tips and tricks back into your daily routine or find ways to work with your team to build a schedule that's productive. That's how you're going to find the time that is lost. So on that note, I'm going to pass this back over to Jacob.
All right. Well, thank you, Laura, so much. Really great presentation. We're seeing a lot of great comments coming in. So everyone, thanking you for your time. With that, the CE is officially over. So at this time, we'd like if you could stay on for just a few minutes for a few quick housekeeping, then some special offers. So I've gotten a lot of questions in the chat here about follow-up materials. So we are going to be sending out follow-up material that's going to include everything from the recording to special offers, upcoming webinars, and everything in between. So be on the lookout in your email for that. And then CE will be coming your way within the next 2 weeks. So be checking your email for that. If you don't receive it in the next 2 weeks, please send us an email. We do have a webinar on Tuesday next week. It's HIPAA workforce training. It's a really great program with Leslie Canham. I have put the link to the registration in the chat right now. So if you are available at that time, we'd love if you can join us. And then if not, I'm also going to be including the link in the follow-up email as well. And then want to also let you guys know about Rectangle Health Services. We have a product called Bridge Engagement that is really a great way for you to engage with your patients. We see that we improve show rate by 1%. It reduces the administrative burden. It's a great way for you to do reminders, mass communication, text. We have all sorts of different features. So if you don't have something currently in place right now to manage patient engagement, definitely give us a look. We'll be following up with you. And then there's also a link to get a demo within our chat there. So Laura, I'm going to send it back into you to talk through Front Office Rocks, and you're off.
Awesome. So mine is Front Office Rocks is a month-to-month virtual training, not just on schedule. We do everything from brand new to dental and somebody you've hired, from Starbucks who doesn't know anything about the words we say, all the way through high-end office manager, doctor training. We have some clinical training and a lot of front office training. So we have a code there. So if you do for FORXRHW, it's $50 off the first month. And within that training, we offer a lot on schedule. So if you have any questions, just come to Front Office Rocks. We have a chat on our website or email us and from the website, and my team would love to help you guys. So, and I appreciate Rectangle. Thank you for allowing me to spend an hour with you before I get on my plane today.
Yeah, well, thank you so much, Laura. Again, it looks like we got out a little early here, which is always good. Give people a few minutes back in their day. When you
Yes.
guys leave, there is a survey, so please fill that out if you can. And then I don't see any other questions here, so it looks like we'll wrap up. But thank you again, Laura, for your time. Really great presentation, and thank you everyone for joining us today. And we hope to see you all again soon. Take care.
Perfect. Thank you. Bye-bye.
All right, bye.